Good morning. Welcome to PHC 100, Community and Public Health, Module 2, Epidemiology. Objectives. At the end of this presentation, the student will be able to: number 1, define epidemiology; 2, discuss a brief history of epidemiology; 3, explain the different epidemiological methods; and 4, define different epidemiological terms and differentiate them with each other. Epidemiology came from the Greek words epi means upon or among, demos meaning people, and logos meaning study or knowledge of. So from such origin, epidemiology is literally defined as the study of what is upon the people. John last defined epidemiology as the study of the distribution and determinants of health-related states or events in a specified population, and the application of this study to control the health problems. So, kung titingnan nyo sa definition ng epidemiology, so merong tatlong elemento. Ito ay yung pinanggalingan, yung tao, at yung pag-aaral. Okay? And the result of this study will greatly help in the control of health problems or diseases and promotion of the prevention of diseases. And people who are engaged in this field or area of expertise are called epidemiologists. So they are the one who do the studying, the analysis of the different data regarding the different diseases that may be significant in our society or in our country. Now let us go to the brief history of epidemiology. It all started with the father of medicine, Hippocrates. He is also regarded as the classical father of epidemiology because he was the first person to know and to have examined the relationships between disease occurrence and environmental influences. He also coined two important terms in epidemiology, and that is epidemic and endemic, of which we will be discussing the meaning later on in the following slides. Now, in the middle of the 16th century, a famous Italian doctor, Girolamo Pacastoro, proposed a theory that very small, unseeable live particles cause disease and are able to spread via different modes of transmission that can cause epidemics. Following Pacastoro's theory, Anton van Leeuwenhoek developed or invent the first microscope in 1675, and Pacastoro's theory was later proven that indeed small unseeable particles cause disease or microorganisms. Now we go to John Snow. Do you know John Snow? No, not that John Snow. Instead, Dr. John Snow. In 1854, an outbreak of cholera happened in London, and Dr. John Snow mapped out the clusters of cholera cases and identified the source or the cause of the outbreak, which was the public water pump system in the Soho district. Thus, he was regarded as the modern father of epidemiology. So he did geographical mapping, as you can see in figure 1.1. Okay, that are the number distribution of cholera cases in the Golden Square area of London, August to September 1854. So in the geographical mapping, uh, Dr. John Snow asked, where do these cases live? Where do these cases work? And later on, yun na, napatunayan niya or nalaman that the cholera outbreak was caused by the water system. Okay. The outbreak declined when no more incidents of cholera was reported after determining the cause of the disease. And this has been perceived as a major event in the history of public health and was regarded as the founding event of the science of epidemiology. Kaya tinawag si Dr. John Snow as the modern father of epidemiology. Another important person in epidemiology is Ignaz Semmelweis. In 1847, he brought down infant mortality in, in a Vienna hospital by instituting hand-washing procedure. Okay. And thus he was known as the father of hand-washing. The importance of hand-washing is that it is the single most important measure to reduce disease transmission from one person to another. The importance of hand washing remains the same to this day. That's why in this period, in these years of pandemic, in these years of COVID, it is important for us to wash our hands frequently. Now we have Joseph Lister. Having heard the name Joseph Lister, what comes to your mind? Let me guess. Listerine. Unfortunately, Joseph Lister did not founded Listerine, or he was not the discoverer of Listerine. In 1865, he developed the aseptic technique, okay, in which is geared towards the prevention of microorganisms from reaching susceptible areas, thereby preventing the spread of diseases. and he is known as the father of antiseptic surgery. Why? Because Joseph Lister is a surgeon and he implemented this aseptic technique in the surgery. In his time, many patients died during and after surgery, and the cause is unknown. Later on, through his study, he noticed that these deaths are caused by the germs or the microorganisms, and therefore in the surgery area he implemented this aseptic technique of which he developed. And there are three epidemiological methods that are being used by epidemiologists today. First is descriptive method. The first phase of any investigation and the protocols includes the following. Population to be studied is defined. Disease to be studied is also defined. Time, place, and personal factors are collected. Disease is measured through various statistical methods. Cause of disease is investigated and reported. Then number two, analytical use of case studies. That is the second method. And the third method is experimental. Use of laboratory animals and different study to designs to identify disease association. So these three are the epidemiological methods utilized by epidemiologists. Now we will be discussing the different epidemiological terms. These terms are usually used by epidemiologists, doctors, and in some cases you will be able to hear this from time to time in the news. So first is communicable disease. This is a type of disease that can be transmitted from one person to another. So this is a person-to-person transmission. Then second is contagious disease. It is a communicable disease that is easily transmitted from one person to another. So it should be very clear that contagious disease is a communicable disease, easily transmitted. Okay? So when asked by this, you should be able to know what you will answer. Are all communicable diseases contagious? True or false? What is your answer? Now, on the other hand, are all contagious diseases communicable? True or false? What is your answer? In the first statement, the answer is false. And in the second statement, the answer is true. Why? Because as we said earlier, that contagious disease is a communicable disease. But definitely, it is only part of the communicable disease or a subtype of the communicable disease. So definitely, not all communicable disease are contagious. Not all can be easily transmitted from one person to another, but all contagious diseases are communicable, as you can see in the definition above. Next term is zoonotic diseases or zoonosis. So from the word zoonotic or zoonosis, definitely you will be thinking about animals. So in these infectious diseases that is acquired or that are acquired by humans from animal sources. Okay? So example niyan yung rabies. Okay? Then incidence, okay, it is defined as the number of new cases of a particular disease in a defined population during a specific period of time. Example, the new number of cases of tuberculosis in the Philippines for the year 2020. So that is the incidence. Incidence of tuberculosis in the Philippines for the year 2020. Following incidence, it is important to know the term prevalence. So prevalence is the total number of cases of a disease existing in a given population. So there are two types of prevalence. Period prevalence, which is the number of cases of a specific existing disease in a population during a specific time. Kaya nga siya ay period prevalence. Okay, so example niya ay, there are 119 cases of gonorrhea in Batangas province during 2019. And the other one is point prevalence. So again, it is the number of cases of a specific disease existing in a given population, but at a particular moment in time. So example niya ay, there are 201 cases of acute respiratory infection in Batangas province at this moment. So that is prevalence. Another important term in epidemiology is morbidity rate, also known as disease rate. So it is the numerical expression of the number of disease cases that occur during a specific time period per a specifically defined population. Let's say top 10 morbidity rate in the Philippines. Then we have the mortality rate or the death rate. Refers to the number of people who died of a particular disease during a specific period of time per a specifically defined population. So when we say morbidity, it is the disease rate or morbidity rate. When we hear mortality, it is death or the death rate. Okay, the next term is epidemic or outbreak diseases. So it is defined as greater than usual number of cases of a particular disease in a particular region usually for a short period of time. One example of this is the 1976 that happened, or the Legionnaire's disease that happened in USA. This Legionnaire disease is a type of pneumonia that happened in 1976. So it spread to the soldiers, that's why it's called Legionnaires. Okay, and it causes an epidemic or outbreak in the US in the year 1976. On the other hand, the term endemic diseases refers to the diseases that are always present within the population of a particular geographic area. The number of cases may fluctuate over time, but the disease never dies out completely. So the example of this is malaria in Palawan. That's why when you are filling out for the form for blood donation, so it is always asked if you are a native of malaria, or kung a native of Palawan, or if tumira ka sa Palawan, because they are going to screen your blood for malaria. Again, when we say epidemic, outbreak or greater than usual number of cases. And when we say endemic, it is always present in a particular geographic area. The next term is sporadic diseases. So these diseases occurs occasionally only. Occasionally, paminsan-minsan. Within the population of a particular geographic area. Example, botulism, tetanus, and gas gangrene. Okay, sporadic, occasionally occurring within a population of a particular geographic area. Endemic, always present within the population of a particular geographic area. Epidemic, outbreak, greater than usual number of cases, usually for a short period of time. Then we go to the pandemic diseases. These diseases are occurring in epidemic proportion. Okay, when we say epidemic proportion, outbreak greater than usual, greater than usual number of cases in many countries simultaneously worldwide. Kaya nga siya ay pandemic. Okay. So example of these pandemic diseases are the following: AIDS, okay, tuberculosis at one point in time, and COVID-19. Sorry, that's not COVID-12. It should be COVID-19. Okay, so now, kilala natin yung pandemic, di ba? Because we are experiencing it in our daily life since 2020. So, class, now you know the different epidemiological terms, especially when it comes to the disease occurrence. We have the epidemic, the endemic, the sporadic, and the pandemic. In this slide, you will see the top 10 leading causes of mortality in the Philippines. However, this data is from 2013. There is no updated data yet for 2020. Okay, so the top one is diseases of the heart, followed by diseases of the vascular system, followed equally by malignant neoplasms and pneumonia, then accidents, diabetes mellitus, chronic lower respiratory diseases, all forms of tuberculosis. Then number 9 is nephritis or nephrotic syndrome and nephrosis. And lastly, certain conditions originating in the perinatal period. Okay, so these are the top 10 leading causes of mortality. And in this slide, the top 10 leading causes of morbidity. So the data is from 2014. Okay. The highest is acute respiratory infection. Then we have followed by pneumonia and acute lower tract respiratory infection, followed by hypertension and urinary tract infection, followed by bronchitis, influenza, and acute watery diarrhea. Okay, pulmonary tuberculosis or TB respiratory, dengue fever, and other forms of TB. So why do we study epidemiology? What are the importance of epidemiology? First, epidemiology establishes the cause or causes of diseases. It helps in community diagnosis. It gives clinical picture of diseases, provides least distribution of diseases, and helps in the investigation of an epidemic or even in a pandemic. It helps in the identification of risk factors and establishes disease prevention, treatment, and control methods. That and all this importance can be seen today on our daily experiences in this period of COVID-19 pandemic. So these are my references. Thank you for listening to my lecture today. Have a great day, enjoy, and don't forget to click on the subscribe button. Again, thank you very much. See you next meeting.